Why can't the drug addicts just quit?
We have a crisis on our hands.
And now, with not enough people to treat substance use disorder, we've had a 25-year-old failed experiment.
We need to talk more about the impact of drugs, addiction, treatment, and recovery.
Addiction is the last chronic disease that we have.
The summit is really about
systems are set up to progress.
epidemic that we have.
They come to my pharmacy and I can't give them medicine.
Our country is suffering terribly from the epidemic of suicide and addiction and mental illness.
It's chronic. That means it doesn't go away. It's progressive.
Driving under the influence of alcohol and cannabis.
There's always been the great argument, is this an illness? Is it a sin? Is it people that are just criminals?
So it's a balance. How do we engage people and work with them and attract them into recovery, especially those 20+ million people who don't even think they have a problem?
Way back in the day, and I'm using the royal we here, probably about 1 in 10 people made it. Now, unfortunately, we would brag about that. We would go, well, which one of you is going to make it?
We measure treatment readiness by the fact of have people hit bottom.
Very little attention is paid to addiction, substance use disorders.
If it's breast cancer, there's 5,000 people in the mall up at the Capitol with pink shirts on. But if it's about addiction,
somebody that's exposed to substances will remember that experience.
University of Florida has stepped up.
I love the way this summit has been organized.
As a result of these changes in 2011.
We start with a policy day. We now have a medical day. And the brain, of course, is going to respond differently after traumatic brain injury. And tomorrow's our recovery day.
It's an opportunity to interact with not just treatment clinicians, but also with policymakers, so with a broad audience that can influence all the different aspects of drug abuse.
It's one thing to be publishing articles and talking in an ivory tower. It's another thing to translate that into language that the public can understand and policymakers can digest.
To keep people alive, that's what it's all about. Once you hug a mother who's lost her child to prescription drugs, it changes your life. And we have young kids now who are being marketed these synthetic drugs that are being sold to them as Scooby-Doo and cotton candy, and they're truly lethal.
But what parts of the brain are activated during that experience of craving or urge to use drugs?
Science can help us inform policy so that we can make smarter decisions about how to treat drug abuse and how to prevent drug abuse.
102,000 people in Florida's prisons. 65% of them have a drug problem. We have 150,000 people on probation. 56% of them have a drug problem. We spend less than 2% of the Department of Corrections budget on treatment.
Too few people are coming into treatment, and we know.
When we look at the data and literature on treatment successes for addiction, they're as good or better than treatment successes for diabetes, hypertension, high cholesterol.
These kids dying of OxyContin overdose or heroin or whatever, we got to get them to show up. If you're being screened for skin cancer, you also ought to be screened for addiction. If you're screened for cardiovascular disease and giving Lipitor, you ought to be screened for mental illness and being given the proper medication.
The synthetic cannabinoids generally kind of made their way over here around 2008 or so.
When I educate patients, they go back and educate their providers. When I educate providers, they educate patients. When we educate family members, they educate both.
It's having multiple impacts on society. And it's undeniable.
Those who began using cannabis earlier than 15 years experience psychosis at a significantly younger age. It's really wonderful to receive the gift of recovery and help carry it forward.
Patients don't walk in the door and say, I think I've got an addiction problem.
The happy moment is communities are safer. The happy moment is I get fewer calls from moms saying, my kid's addicted and I don't know what I should do. The happy moment is people have insurance and they can go and the doctors understand about addiction so they can channel them to what level of care they need to be. And the happy moment is people find recovery.
We have a kind of perfect storm here.
The illness cuts across everybody and treatment needs to be available to everybody. I applaud the University of Florida for pulling this event together.